This podcast features Atlanta Clinical and Translational Science Institute faculty and their guest faculty discussing various topics in research ethics. The opinions these individuals express are their own and not necessarily those of Emory University, the Georgia Institute of Technology, or Morehouse School of Medicine. Furthermore, nothing in this podcast should be understood or taken as legal advice. This podcast is copyrighted by Emory University, 2016. So, Mary, something that I learned from you is how that mentor-mentee relationship needs to be negotiated, and that much of the impetus for that should come from the postdoc.
You're probably learning what it means to be an academic researcher for the first time. You're learning all the things that make for good science. So naturally, the graduate student is very dependent on professors and advisors. And let's face it, ultimately the graduate student has to do work that reaches an acceptable level, because if they do not, they're not going to graduate or receive their degree. In graduate school, there are a series of external requirements to satisfy for success, such as courses, exams, qualifying PhD exams, dissertation committees. The graduate student, very much unlike the postdoc, is controlled by many external norms.
So the graduate student may be in a dependent and perhaps passive role as he or she is developing research skills.
Yes, graduate students have to satisfy their committee members. So they may have what they think is the most fabulous research idea ever conceived. But if their advisor and committee members disagree, they're in for a hard time. The postdoc, though, is quite different. The postdoc must be the driver of their success and choice of career path. There are no exams, courses, dissertation committees. The postdoc must operate from an internal but not external set of choices for personal training and career development. Postdocs generally have more freedom to do something novel and creative. And many postdoc mentors, but not all, expect postdocs to have creative research ideas when arriving in the lab.
So therefore, the postdoc can be much more assertive in going forward with their own research agenda, and as a byproduct of doing that, can seek to make a name for themselves.
Yes, but that in itself can be tricky. It is tricky because unless the postdoc research ideas have been communicated to the mentor initially and discussed with him or her, there can be major problems. I've occasionally seen it happen where a postdoc conceives a research plan without much input from the mentor or advisor, and then spends weeks and even months alone doing that work. When they present it to the mentor, and the mentor dislikes it and thinks it is worthless, that can be psychologically devastating, not to mention the time and materials wasted.
So, Mary, you talked earlier about negotiating expectations, and this sounds like a failure to do just that.
Yes, the problem we just talked about is exactly that. The problem could have been totally avoided if there had been initially and continued communication between the postdoc and mentor as the research progressed. Communication is the key word for postdocs. One of the things I try to impress on my postdocs is the need for them to shape the advisor-postdoc relationship with proactive communication, both verbal and written. Don't depend on the mentor or advisor to do that. And that can be a bit unsettling, John, because if you're used to taking directions as a graduate student, the postdoc may not have developed the communication skill set to shape the agenda with the mentor.
So, Mary, do you have any specific recommendations for how the mentee can shape an agenda with the mentor?
Sure, and thanks, Jason. One thing is, find out how your mentor likes to communicate. What time, like early morning, over lunch, after work, or maybe after seminars or colloquia. Then, does she or he like to get structured reports or just informal follow-ups, that sort of thing? But the most important thing is that once you find out how they like to communicate and when, then develop a schedule with the mentor and stick to it. Personally, I would suggest a meeting in person at least every 2 to 4 weeks in his or her office or conference room, not just a hallway chat that lasts 3 minutes. And you need to determine the most important things to discuss in the in-person meetings, whether it's your methodology, questions about measurements or data gathering, and especially, what is the final outcome or goal of the research being sought? Another suggestion is to have an email tracking of your personal research production prior to the face-to-face meetings. It is a good pattern to summarize in an email or as an attachment to an email every 1 to 2 weeks what you have done and what you intend to do in just 1 or 2 pages. The more specific and precise you are, the better. In addition, after each in-person meeting with the mentor, it is good to summarize the meeting with just a few sentences and email it back to the mentor or supervisor just to make sure you understood his or her message accurately. In-person meetings are also an excellent time to discuss career path choices, presentations at national meetings, publications to be written, etc.
And you know, what you've just described is an excellent memory enhancer or reinforcer for the mentor.
Exactly. It will remind the mentor, him or her, of your work, how you're proceeding with it, and where you want to wind up. It will help the mentor to think you are both in control of your research project and your career path. These communications are invaluable to the mentor and to you when writing letters of recommendations for jobs.
That's excellent advice, Mary. So, adding to our conversation, what do you think of IDPs? Are they a useful tool for graduate students and postdocs?
Absolutely. IDPs, or individual development plans, are becoming increasingly common in some research circles, and especially including NIH-funded postdocs. I think they're an excellent tool used initially for the first 6 months of training, when the training and mentor can discuss and agree on research projects, goals of this year and future years, create key training areas needed for the postdoc, etc. The key to using the IDP is to revisit it with the mentor at least once a year in each subsequent year of training, especially for the postdoc. Discussions of possible changes each year in choice of career path or goals of research projects have to be clarified and acted upon in a timely manner. It's not uncommon for graduate students and postdocs to have career goals or research goals that change over a 3 to 5 year training period.
Thank you for those insights, Mary. Is there anything else you would like to add before we conclude our discussion of mentoring?
Yes, I would like to add that we need to reiterate one more time that good mentoring requires a good skill set. Of course, it requires not only good technical advice, but having the personal, relational skills to make the mentee feel supported in both their research and their career path. Also, institutions need to provide formal assistance to mentors, like places where they can get advice when they meet up with a challenging situation. So there should be identified people who are recognized on campus and who can help other mentors or mentees when something unexpected comes along. Graduate students have had the support of a graduate school and office for many years, though the importance of such an identified office and person for postdocs has not always been there. In the last 15 years, the need for a postdoc office has gained great national visibility. In the year 2000, there were 30 postdoc offices nationally. In the year 2016, there are now nearly 200. The time of the postdoc is becoming visible. Thank you.
Well, Mary, thanks so much for your insights and your advice.
You're welcome, John.
This concludes our podcast. Thanks so much for listening. Other podcasts and ethics materials are available at the ACTSI website.